opportunities? Sorry, I jumped the gun there, Andrew. What are the funding opportunities for enhanced care management and community supports? And so we talked about it. I'm going to go back to the slide with it just to give everyone a visual. I'm a visual learner. So there's two primary sources of funding if you're thinking about becoming an ECM or community supports provider. One is PATH, and they have two direct grant programs through PATH. One is for the justice involved populations, and there's a lot of rules around who can apply for those. I think there's 1 or 2 rounds left of that. So if you are a county agency, a sheriff's department, probation, or a community provider who's involved in this, there's some money on the table there that you could access. The cited funds are the ones where the state is granting those directly to providers. They've had 3 rounds of that. A lot of money has gone out the door and has been really instrumental for providers to jumpstart their programs, hire more staff, rent a bigger office, buy the computers, all that good stuff. We expect to have the last round of funding, have that application window open October 1st. Generally, how it's worked is you have a 30-day application window, and then if you are granted the fund, you may not see those dollars until maybe early 2025. It can be 3 months, it can be 4 months, it can be a little bit longer, but it's not immediate. So I think I encourage everyone to apply for cited, but knowing that maybe a little bit of a lag time. The other path, which is important, is called IPP. So these are similar to the HIP funds, where the managed care plans had to earn the IPP funds through reporting, through addressing certain goals of the state. And when they earn those funds could be, they were given to the plans, they could be used as individual grants to providers, or they could be used for community-based projects. So maybe the plan felt like there should be more data sharing, trainings going on. The state really did not monitor how plans spent those dollars, but most plans spent them on, a portion of them at least, on direct grants to providers. Those funds have all been distributed to the managed care plans, so we don't think there'll be any more coming. Some plans have just recently had an application window that closed very recently. Some may still hold one. I do think that plans are trying to fill gaps in their ECM and community supports programs. So maybe they look for a provider who can do recuperative care services or a sobering center. They may be saving all the rest of their IPP funds to really specialize and target those providers to get them up and running. So if you are interested in IPP, I would talk to your plan and find out where they are with it. I have a couple of plans in some counties that are really saying, we're done, but they're doing what's called an off-cycle application. So for those special providers they really want to engage with, they're opening it up under a limited basis for them. Did I capture, Lisa and Barry, your questions that we're kind of talking about over break?
Yes, Gretchen, I appreciate it from my perspective.
Any other questions on funding? I was telling Barry, I know for the HIP dollars, the state has said that whatever funds were not spent through HIP, they're going to reallocate those unused dollars. I was hoping we would see that about IPP as well, but I have not heard anything about that through IPP. And I'm guessing with the state budget crisis, those dollars will be clawed back into other programs. Any other questions on funding? No, all right. Well, I hope you all got some coffee. I want to now jump into what you all are very excited about, which is our MOU conversation. So forgive me as I scroll through some slides. Don't want to get anybody motion sick here. So this is going to be a conversation, I hope, from all of you, because I know you all have lots of questions and thoughts and experiences to share. And I am going to invite Baljeet to really jump in and help, answer questions here. She's definitely an expert on these MOUs and can answer a lot more than I can. So I want to start the conversation, but I'm going to invite Baljeet to really engage with all of us as you raise your questions. So, MOU time. So again, as we've talked about before, I think this is a really great opportunity to engage with your managed care plans. Our managed care plans aren't going away. They are here to stay. They're part of our healthcare system and all of the counties now. I think they're just going to continue to grow. We're seeing this across the country as well. Managed care plans are just getting more and more of the Medicaid, Medi-Cal population. So get to know them, invest in those relationships. Again, I think there's going to be a lot of knowledge gaps from the managed care plans. So be aware of those. If it's appropriate, invite them to your meetings, help them learn. And I was the same for your staff. Have them get to know the managed care plans. What are the managed care plans goals? What are their expectations with these MOUs? Start to really have those conversations, not just in a formal way of what policies and procedures we need to create, but just in an informal way so we get to know each other. The other thing that I'm hearing a lot about, and I think this is something for you all to be aware of, is the managed care plans are not always aware of the intersections between programs. They're not always aware of how you may talk with probation or how you may talk with foster youth or how, I think they need to be educated about how counties operate. And again, some of them think, I know one county, I know them all, but we know that's not true. So let them know how you operate, how your staff does assessments, what your timeline's on, who you're engaging with. If you have various meetings that's appropriate for them to come to, invite them. Oftentimes we're seeing the managed care plan send someone out to be part of those meetings, even if they're in person. So I know you're not teachers for the managed care plans. We don't expect you to be, but I do think it's something to consider about when it makes sense for you all to do trainings for them, when it makes sense for you to sit down in a one-on-one and explain some things to them. I think this will generate a lot of results down the road if they understand how you do things and why you do things. So now we're going to have a couple of slides here about some very general MOU requirements that are going to be in all of the MOUs. And we're going to cover these kind of as a lump sum so we can think about this across multiple MOUs and not just across the IHSS or the CWS MOU. So standard language you're going to see in the MOUs is what are the services that are covered by this MOU for both parties, both the MCP and for the county, and what needs to be coordinated and who's in charge. So you're going to start to see all of this in the MOU. What are the obligations of each party? Who's responsible? What's expected? What compliance mechanisms are in place, et cetera, et cetera. And for some MOUs, this is not just for the MCP, but also for their downstream providers and subcontractors, as well as for counties. Training and education. There are requirements around training and education. I think there's probably more that could be done informally for the managed care plan, so they're aware of what you guys do, what your expertise is, but there are going to be some trainings required, oftentimes for the managed care plan, to educate their members and their provider networks. So that can be focused there. Again, I do think there's opportunities to engage with managed care plans to make sure the trainings they are giving are accurate and appropriate for how your county operates. We're actually seeing this a lot in some of the justice involved services being rolled out. The managed care plans want to roll out a standardized training across all counties, and we're starting to see the counties say, hey, we don't do things that way. We're different than Alameda, or we're different than San Francisco. And so again, I think just being aware that we want to have the trainings really appropriate for how you do your work and not a standardized approach to just a certain population across all of the counties. There's language in all of the MOUs around referrals. And I think this is really going to be important to think about and to have informal conversations about what expectations are, what are standards of practice. I do believe there's going to be not just a knowledge gap, but probably also a vocabulary gap too. What does it mean for referral coordination? It may mean one thing for you and your staff and something totally different at the managed care plan level. So just being aware the gaps that may exist are at very different levels. Okay, so referrals, how do we refer to each other? Whose responsibility is it? What is the workflow around that? Are you using a fax machine to fax over referral information? Are you using email? I don't know. I know a lot of managed care plans still use fax. So They also have portals, so can counties access and enter information into those portals? I think all of these things are going to be important to figure out. Care coordination. This is where there may be a need for formal policies and procedures. What does it mean to coordinate care? What is it? Who's involved in the coordination of care, right? What does this look like? How do we encourage folks to really actively do this and coordinate with each other? We also know that for some of the MOUs, the managed care plans are responsible for coordinating care with other managed care plans. If we have an individual who moves between counties, in some of the MOUs, there's an onus on the managed care plan to coordinate care with the other managed care plan. So what does that look like? What is the communication channel for doing that? How does the provider know it's all happening? A big piece, which we hear a lot about, is the data sharing component and confidentiality. What is required? What is nice to have? What is inappropriate to share? I think these are all questions that we're going to be asking. And I know from talking with various counties in these trainings that some counties have some stricter concerns than others. Some have figured out a way to do this in a way that feels good to them. So I think this is a great opportunity to share with each other what you all are doing around data sharing, how you're thinking about data sharing, confidentiality, consent, all of that's going to be important to share best practices. We're all learning how to do this together. And then there's quarterly meeting requirements. So we have to at least meet quarterly to address care coordination, quality improvement, et cetera, et cetera. What does quality improvement mean? What's required in the MOU? What are your expectations? What are the MCP's expectations? They may be very, very different on QI activities. So I think having those conversations, talking through them is going to be key for some of these MOUs. Dispute resolution. These are policies and procedures. What happens when there's a disagreement? What do we do? Who's responsible? All that good stuff is laid out in these MOUs. Any questions on any of these kind of standardized pieces of the MOUs? All right, then we are going to jump into the IHSS MOU and kind of talk about what's in that and what's particularly of interest to folks working on this MOU. And I'm trying to approach the MOUs as being an opportunity for engagement, for partnership. I know it's not always going to be easy and there's going to be a lot of challenges, but I do think this is an opportunity to build that rapport with the managed care plan. They are here to stay. This is one more bridge to use to develop that relationship. I'm going to say this again. I think there's knowledge gaps, and I think having you guys explain how you do things, what assessment tools you use, what is your process for doing all of it is really, really important. Having them understand how your county does it, not just what a county in California is doing. What's care coordination for you and your staff? What are the closed loop referrals that you're doing? We know that the managed care plans are going to have to implement some type of closed loop referral system, I believe, by January. So how will this impact the work that you're doing? How will this impact how you're engaging with the managed care plan? Questions on this? What are those coordination opportunities? I think this is another, again, trying to have this positive lens here on the MOUs. I know a lot of it is overwhelming and daunting, but I think there are great opportunities. One of the things that we talked a lot about with some of the other CalAIM pieces across the state over the past 2.5 years is what are the gaps that we have in our system of care? What are the gaps we have in terms of providers? What are the gaps we have in terms of knowledge? And so how do we work together to start to fill those gaps? So step one, we identify what they are. We know managed care plans have some more resources. And so how do we engage with them in a way where they may understand what the needs are in our county and how they may be able to help with that, whether it's trainings, whether it's other types of resources, whether it's manpower. I think thinking about how do we start to build that rapport? How do we engage them in what our county's needs are, and then start to chip away at some of those gaps? So using them as a partner in this process. We know that for all the MOUs, we do have positions that are identified that the MCP must have, including the responsible person, the liaison, what are those roles? What are the actual things they're going to be doing? What does this look like? How do we coordinate with each other? The county positions, we're going to have that responsible person as well. We're going to have the liaison with the managed care plan. So really thinking about how these positions engage with the county, engage with the managed care plan, and engage with each other. I think there's a lot of an administrative burden on counties for these MOUs. We have some new things that are, again, challenging to think about, and some things that probably may be good for us to start thinking about and engaging in. So I think the data sharing is a big one. And again, for some organizations and for some populations, data sharing can be more challenging than for others. But thinking about what that looks like, what systems are being used, how do we coordinate care with the data that we have, that we all have access to? Data for MOU effectiveness, how do we measure the effectiveness, excuse me, of the MOUs? My allergies are kicking in here. What consents need to be given? How do we track that they've been signed? How do we document that? How do we know everybody else knows about the consent? Again, what systems are we using to track, share, collect data? Quality improvement. I think we all want to, continuously improve the things that we're doing, to work on them, to make them better, to get better outcomes for the folks we work with, to create more efficiencies, to save money. I think we all share those goals. So what does that look like? What are the expectations as part of the MOU? Again, different languages may be used around QI for MCPs and for counties. So just be aware that you probably need to flesh out what a test of change may look like. Do counties understand what a PDSA is? I don't know. You guys use different models for QI. So talking through what's going to work for the MOU. Quarterly meeting expectations. What is this quarterly meeting? Who's running it? Who's doing what? Where is it being held? Is it on Zoom? And talking through expectations so that we're all clear as to what is needed, who's doing the agenda, what needs to happen. And then I also think about having a toolkit for the MOU, of thinking about what are the trainings that my staff need here at the county? What are the trainings that the MCP staff need? Who's running them? How do we collaborate on them so they're really being effective and true to the work that we're doing? Policies and procedures. We know there are some that are required by the MOUs. And we also know that managed care plans don't like to have a lot of policies and procedures beyond what's required, because the state can then hold them accountable. And so we do see a lot of work being done in other programs. Instead of doing policies and procedures, we have workflows, we have expectations, we have guidance. So thinking about what needs to be in those policies and procedures and what can be accomplished through other mechanisms, I think is going to be important as you work with the managed care plans. What are the priorities for the managed care plans in your county? What are the priorities for you and your county around these MOUs? How do we start to engage on those? So I would love to find out from the folks that are here, if you are working on IHSS, what are you doing about data sharing? Anyone want to come off mute and talk about their approach to data sharing with the IHSS MOU? Right, no takers on that. What about with trainings?
Gretchen, this is Mike from Solano County.
Oh, hi, Mike. Thank you for coming off mute and being on camera. Great
there you go. Yeah. So we have not entered into an MOU yet. And so we have been kind of watching at this point, as I'm sure a lot of counties are. and one of the key components that we've heard from like Sacramento and others that data sharing was a big component of figuring out how these MOUs are going to work. What information are we going to share? How do we share that information? And where do we get a release to be able to share that information? And what level of information are we sharing? And so I know that these things are still kind of a hot topic, but we haven't entered into an MOU. So we're kind of sitting back and seeing how other counties are addressing it before we enter into it. Our managed care plans have not, kind of been have not been chomping at the bit to talk to us.
Oh,
And so
interesting.
we've utilized that to kind of just sit back and see how other counties are developing their plans.
No, thank you for sharing. There's a lot of counties that are in the same boat, so I'm glad you raised it, and I would love to hear about folks maybe further along in the MOU process, how they're thinking about data. And I know, Bruno, you came off mute as well. Go ahead.
It was actually, we're in the same boat. Actually, it's not haven't started necessarily looking at our IHSS. We're still working with our foster care population, but we have the added bonus of managed care plans, mental health managed care plans in the mix. And we are collaborating. So I think the fact that we do have a collaboration with the mental health managed care plans for our foster care youth, that makes it a little bit easier, because it makes it a little bit easier in data sharing, I think, because we have something already set up with them through our contracts or our collaborations. I think for the IHSS, the key would be is what kind of information, if we know what kind of information we want to get, like really, like, because like we hear that from our behavioral health partner, like we'll share what is that you need, what is that you want. We have a contract. You don't need to be here, but you don't need to see the whole record. I think that fear is they don't want to necessarily release the record, and I don't think we want to see the whole record. We don't want to be liable for the whole record. We just need what we need for the plan and for the care for nation. That's it. And I think for IHSS, I don't think, I'm going to speak just for Fresno. We haven't thought about what is it that we want to get shared with us. So I think that would be key for them to start the conversation with the managed care plan.
I like your thinking about this from two angles too. What do we need from the managed care plans, and what are we willing to share? So I think that's really important to have a conversation about. Thank you for sharing, Bruno. And Nicole, do you want to come up? Oh, go ahead. I hear someone else.
Yeah, this is Yusuf from Yolo County, and I just a couple of components is one, we have some MOUs with, for example, like Kaiser, and it's very restrictive in terms of what are we sharing and what they are sharing with us. And I think a big thing is gonna come up to both counties and managed care is what exactly do we want to share with you, and what exactly you want to get from us. I think one of the biggest things that I'm looking forward to is to start receiving referrals from managed care for people that needs IHSS. And that's straightforward. We don't need that much information, just the name and the address and who needs the help. But once we go into more information that is needed from us, that's when I believe the MOU should address, most importantly, with either managed care or the county sites.
So Yusuf, are you thinking about this kind of being an iterative process too? Let's try something, let's look at the referrals from the MCP, and then we can start to see what's working, what's not, and trying to adapt as we move through the process?
Yeah, it's been our approach in Yolo County. Just, start the process, see what we need in terms of what are the basic information we need.
Mm-hmm.
Let's get it, see what we can do with it. And then maybe this is why I really like this quarterly meeting expectations, because it's gonna give us a chance to look at what works or what didn't work, and then we can enhance it from there and either get better or omit stuff that we don't need.
No, wonderful. Thank you for sharing that, Yusuf.
Of course.
And then Nicole, do you want to come off mute and share what you put in the chat as well?
We haven't entered an MOU as well as some of the other counties. However, we've been doing our IDT meetings monthly. And so that's an area where we're able to kind of share data with outside agencies, with mutual clients, to see if we can coordinate care that way.
Are the managed care plans part of that meeting?
Not as of yet.
Okay. Are you considering inviting them?
I'm hoping to. That would be great.
That'd be great. Thank you, Nicole, for sharing. Are there any counties here today that have done the MOU or are maybe further along in the process that want to share about the conversations they've had around data sharing?
I can speak for Orange County. I'm not sure if anybody else is from Orange County's on in the meeting. I didn't notice. So we have been working very hard. We actually, I feel like we're pretty proactive in meeting with our county MCP. We just have two. We have Kaiser and then one other one, and primarily been working with the one other one because we're a little bit behind with Kaiser, but because they haven't really reached out that much. But we have been really struggling with the data sharing issue. They had asked us to enter into a business agreement so that we could access their portal to get some of the information, like find out. I think our big thing is we want to know what happens with our referrals, or if one of our clients or IHSS recipients is, referred for one of the services, or we're notified that they're part of one of the services. We kind of just want to know that, and which service, that kind of thing. But per our legal counsel, we couldn't enter into that agreement, and so that kind of shut down that portal for us. It's been kind of our contracts department is kind of handling the negotiation right now, so I haven't received an update in about a month, so I'm not sure if anything else. I know kind of all hands were on deck trying to work out something. And I kind of what I think Bruna, is that what her name is, said earlier, we've really had a lot of internal discussions about what do we want to share with them, and what do we want to get from them? Because we were like, oh, we want to know what medications they're on, what, services they're getting, who's in the house. But then we decided maybe we don't want to know that much information, because, what if our information is different? Then it's going to create a whole bunch of work for our social workers and going back and reaching out. And so maybe not a lot of information is good. So we're kind of at that point right now. But we are, I think further along than some of the counties in trying to work this out.
No, I appreciate that. So the MCP wanted you to sign a business associate agreement.
Yeah,
which
the
is BAA.
BAA.
Okay.
Yeah.
I've heard some counties are not willing to do that. You're not the only ones. So
yeah, and it was because we're not a HIPAA,
Yeah.
it was HIPAA stuff. So it wasn't that we didn't want to, it's just, I think that we were precluded from doing that. So, so, and that was kind of their only option at the last meeting that we had. So I'm sure there's been some more progress. I just haven't been updated yet. So.
No, thank you for sharing. This is all really helpful. Yeah, thank you. Bruna, I see you have your hand up again.
Yes, as she was saying that they were asked to do, we do have meetings with our managed care plan, so we're to Plan County. What's it called? But what they have offered, meaning the managed care plans have offered, that we can become a referral entity, and we can check on the referrals that we make and see the progress of those. So we can, there's that, they've offered that. So I think, it's Blue Cross and First Health. What's it called? They've offered that, and I believe Kaiser's working on the same, something similar, that they can follow. We can follow our own referrals. We just can't see other referrals or self-referrals kind of thing for services. So that's as far as advantage hearing that they're willing to do or okay to do without an actual MOU. We were actually asking our behavioral health partners, should we become a HIPAA entity? Will that give us the information? And we'll go through that road maybe. But then again, it was, well, what information are you not getting? Because we have contracts in place and MOUs in place. And we really couldn't answer that question at the time. So again, going back to what it is that we're asking for.
And Bruna, you've been able to see the outcomes of the referrals you make. Where, maybe I didn't hear it, but
They
where
have they presented their platforms that they
Okay.
use for referral services, so you can see where the referral is going in the process.
And is that gonna be Find Help, or is that the managed care plans portal?
It's I think they're using Find Help.
Okay, yeah, a
As
lot of them are.
Yeah, yes, it appeared they were both were Kaiser, not yet.
Okay, so just, okay, other ones, yeah, Anthem and California Health and Wellness. And then are they gonna pay for you to access Find Help, or is it a free service to get those, through the referrals?
It sounded like a free service. We didn't get that far. You can just create an account. And in order for you to create an account and run reports and see where the referrals were, create one account. So that
I think that's wonderful, yeah.
Yeah.
Great, thank you for sharing that. That's really helpful.
I can share some updated information on IHSS and the MOU. So Andrea did share in the chat. We have an upcoming webinar next Friday on the 24th, 8 o'clock in the morning. So bright and early, folks, that we are going to walk through the MOU. And so it's been a process to get where we are with the MOU. We did meet with several counties. Some of you are on the call today, but several of your peers throughout the state to get feedback on the MOU. We had a couple of listening sessions where I walked through the entire MOU, you know, word for word, and solicited questions, concerns, comments about the language that's in the MOU, the understandings and everything. And so we've made some adjustments to the MOU based on the feedback that we got from counties. We also did present it to the state at DHCS to get their feedback on it. And really the state's position is, as long as you don't change anything that the MCP is contractually required to do per their contract with the state, that's okay. They also don't want anything financial added to the MOU either. Anything additional that you add or delete, again, that is not a contractual agreement. They were in full approval around, if you can get your managed care plan to agree to something in addition to what's already in the MOU, go for it. You know, the IHSS MOU is a lot different than the child welfare MOU, the care coordination, referrals, all of this. One of the things that I think for the IHSS staff here on the call, it's really around helping the managed care plan understand the IHSS program. You know, that care coordination on the IHSS side would look a lot different than it would on the child welfare side. You know, we've got to educate them on the high caseloads, the workload demands on IHSS, where, you know, we want staff to be in the field doing the assessments, doing the reassessments. We don't want them necessarily stuck in the office doing these care coordinations and referrals. And so, you know, the approach I would encourage, just like Gretchen has been saying, especially on the IHSS side, is really helping to educate them on your program. How does it function in your county? You know, how big are the caseloads? You know, who are the staff assigned? So that they have a better understanding, because I think our biggest fear is that they don't really understand the program and how folks become eligible. How does one, you know, get referred, get onto a wait list? How does the intake happen, the assessment and the documentation and all of that? Other parts of the MOU, like training. So we were able to get the IHSS program at CDSS has agreed to provide the training for the managed care plan staff that are going to need to be trained on IHSS. Not to a level that they then become experts or are able to do the assessments or anything like that, but enough so that they understand the program better. So they did agree to that. That's a huge lift that I feel has been taken off the counties, and the state at CDSS has agreed to that. And we did have one meeting with CDSS already on what this training would look like. We had several county partners there as well, and they gave feedback around what this training should be. And so now we're just waiting for CDSS to come back to us on a draft training module for this. They were really looking at the IHSS refresh module that they already provide and kind of using that as the guide for the managed care plans. Around data sharing, you know, the data exchange, you guys have already highlighted a lot of the concerns that came out of these listening sessions around, you know, how do they want this data shared? Because currently there is no mechanism in place to get data from CMIPs and to share it back with the managed care plans. And so counties had a huge concern around, are we going to have to create spreadsheets and, you know, reports that then are uploaded to the managed care plans? And nobody wants that. And I'm going to say even the managed care plans don't want that. We are still trying to get more definite answers from DHCS around exactly what information do you share already? What does CDSS give you that you then share on to the managed care plans that is beyond just aid codes? And someone said, and I agree with this person around the concerns around what if what they share is different than the information that you have? You know, you've done your assessment and the information, it's not matching. Then what, right? What's the expectation? Whose responsibility is it then to get the information to match? Another big concern is if we're sharing information back, does this become part of their medical record that the managed care plan uses for later decisions? And so that's another concern. And we're going to go through all of this during the MOU webinar. We have actually striked out a lot of, there's an exhibit that's attached to the MOU that talks about some of the information that you can share. And I believe in the last revision that we did, we striked out a lot of that language. And it's really up to the county and the managed care plans to come to a consensus. And it may be that the only way that you can share information is if you have that release of information, that you are not going to provide any additional information without that. And I think we've heard from several counties stating that that's probably the only way that they're going to be able to do this. Now, that does become a workload issue though, right? Potentially, because if you're having them sign releases of information when they first come onto the program, do we have it where we have them sign a new release at the annual reassessment? And if not, then do we have to go out and get all these releases signed in order to exchange information? So some of these nuances really have to be worked out at the local level, at your county level, right? And then the policies and procedures, like Gretchen said, we have learned, we actually partnered with one managed care plan, Partnership Health, who are in 24 of the counties, and they did review our revisions to the MOU. And so we will be sharing some of those as well if we adopt what they asked for in the MOU. So all of that will be discussed on the 24th, next Friday. And the link to register for that is in the chat.
Thank you, Baljeet. That's really helpful. Any other comments on IHSS before I move into the CWS MOU? All right. Again, ask questions, whatever point in time they come to you, but we're going to jump into the CWS. Very similar approach, again, trying to find opportunities here, trying to look at this as a way to build new partnerships. So for the CWS conversations, I think there's a huge knowledge gap with the managed care plans. I don't think they understand what you and your staff do to the extent they need to really be a good partner for the counties in this MOU. So I think, again, thinking about where you can invite them to learn more, how can you educate them, is going to be really important. I don't think the MCPs are always aware of the 2083 system of care. And so I think, again, helping them understand that. I was just in Santa Clara yesterday, and they are inviting the managed care plans to join some of their 2083 meetings, which I think is wonderful. So looking at, is that a good thing for you and your county to do? Is that appropriate for how you guys operate? So again, knowledge sharing opportunities, where do we educate them? How do we educate them? Is part of it just trying to get them involved in more of the conversations, which may be the best case scenario for some of the work you're doing. And again, thinking about where are the, how do you intersect with other programs, with other agencies, making the managed care plan aware of how you operate? Are you involved with probation? Are you involved with other systems that need to be brought into the MCP conversations as well? So just thinking again about how do you teach the managed care plans how your county operates? Similar things we talked about with IHSS on the coordination opportunities. How do we bring the managed care plans into this? Again, my experience is managed care plans for the most part do want to learn. They do want to engage. It is important to them. So figuring out how you want to bring them in is going to be critical. How do you want to build that partnership with the managed care plans? In the MOU, we do have positions identified for the MCP. They need to have that responsible person. Need to have a county liaison. I believe we're still calling it foster care liaison, though we all know the title is going to be changing. So I don't think the APL has come out with that yet, has it, Baljeet?
No, actually, we were just asking counties to provide feedback on the APL, and I just submitted all the feedback to the state yesterday. And actually, they have already updated the MOU to reflect the change in that position as well, and some other changes that I'll talk about when we finish this on the MOU.
So eventually we'll have it be the child welfare liaison, right? So we'll get to that eventually, but I'm going to keep with what the state has, especially. All right, so on that, and then we also have the county positions, that responsible person, the county liaison, and again, how do these positions interact? What are the roles and responsibilities? So just being aware of that as you start to engage your managed care plan. I'm also viewing these MOUs to be not just an opportunity to engage the managed care plan on the MOUs, but I think it's building a bigger relationship with the managed care plans. How do we start to have them become more invested in the work that we do? How do we bring them in to be a larger partner, not just in a narrow way for these MOUs? So really thinking about how do we leverage these MOUs to build stronger care coordination opportunities across multiple programs. I'm going to encourage you all to think about that. Again, as with the IHSS, we do have quite a bit of administrative activities that go along with the MOUs. And there's probably many more I'm not even thinking through yet, but I think some of the big ones, we talked about data sharing. And again, I think the CWS MOU, the data sharing component is a bit trickier than with IHSS. And so thinking through what that looks like is going to be important. What are the quality improvement metrics we're going to be using? Who's collecting data on that? All of that is going to be good food for thought here. And then again, thinking about a toolkit. How do we help engage our new partners in becoming good partners for us, becoming strong partners? I think that's going to be important. So again, what trainings are needed to educate the MCPs? What trainings do our staff need to have to be a good partner with the MCPs? It does go both ways. Policies and procedures, same idea. The plans really don't want more policies and procedures than they have to have that are required by the state, but there are other ways to try to solidify what the expectations are. There can be workflow documents, guidance documents, different ways you can start to document the expectations, document your commitments that may not have the same hold as the policies and procedures for the managed care plans that may still accomplish what you need to accomplish with them. Any questions or thoughts that folks want to share on the CWS MOU?
So we did just have a webinar on and a walkthrough of the MOU. I want to say it was just recently on the 3rd, but that just seems so long ago.
I think I was part of that, but it seems like it was forever ago. Yes.
And we do have the recording of that. And so if you weren't able to make it, I would highly encourage that you get that, and we can send that out again. Alex Briscoe and Sarah Onquist did the walkthrough of the MOU, as they have been contracted by LA County and Fresno County and a couple of other counties to help them with their MOU. And so they agreed to share it across the state with all county departments. And so they did a great job of walking through the MOU, the additions or edits that they made to the MOU that they really, and we feel, benefit children, youth, and families involved in our system, and really helping managed care plans understand that we don't just work with foster youth in placement, that our spectrum of services are beyond that, right? So we're working with children, youth, and families through ER processes, through differential response, through our prevention work. We're working with young adults through our extended foster care programs, right? NMD status youth. And so really looking at that whole spectrum in child welfare through this MOU, and that we don't want to forget the parents either. They are also crucial to this. And so this MOU is really kind of, like I mentioned before, it's very different than how we approach the IHSS MOU. The state has updated the MOU, and so Sarah and Alex are going to look at the updates and make adjustments to what we have been calling the CWS Kitchen Sink MOU. And so an updated version of that MOU will hopefully be coming out early next week. We're expecting to get it back from Sarah and Alex by the end of this week. And so again, we can give you all the documents around this. They also created a memo that helped you understand the changes. They kind of color coded them so that you understood what the changes were and why. Again, this, and if you want more one-on-one on the MOU, you can definitely reach out to myself and Andrea, and we can help set that up as well. Like I said, I feel like the CWS one is a lot more nuanced. We also did identify 12 plus policies and procedures that probably need to come out of the CWS one as well. And so we're looking at how do we continue to help counties. If you agree to move forward with these policies and procedures and your MCPs also agree to this, how do we continue to help counties lift this work up? Because it is a workload issue. It's an unfunded issue as well, right? And so how can we continue to support counties through this work?
Great, thank you, Baljeet. Michelle, I see you have your hand up. You want to come off mute?
Yeah, so I was in attendance on that call on the 5th, or excuse me, the 3rd. And then I met with our managed care program just this last Monday as like the very first meeting to just kind of do a meet and greet and to understand, that specific person's role with the managed care program and my role writing the MOU on behalf of the county. and how we're going to collaborate and that kind of stuff. We did touch on the AB 2083 teams that are here. I told them that I would route that information to the chair of those committees to see if they are at a stage where they're willing to have non-county personnel attending, because the form and function of those meetings still look a little bit different in our small county. And then we did talk, I had some questions that came from that call on the 3rd about how they defined at-risk families and what that looks like as far as information sharing and communication pathways and service provision at a level where we may be making decisions about safety with children who are still remaining in the care of their parents, and making recommendations to court about parental efforts to remediate whatever safety concerns exist. So it was well received. I felt like he was on board and that took some notes and wrote down my questions, and some things you need to get back to me about. I did have some concerns later about like the contracts that have not yet come up with providers in our area. Like we have no hospitals currently contracted in our area as facilities. That is a huge problem for our prenatal services and for post-tox babies and that kind of stuff that we work with. So yeah, we're gonna be trudging through the mud together, but we've already started the relationship, so I'm excited about what that looks like.
That's great to hear, Michelle. I'm glad that you reached out, and I'm glad it was well received too. I think that's a great starting point. So thank you for sharing that.
And I just want to say that you're also very welcome to come to one of the TA office hours and kind of bounce off, some of this that's happening as you're meeting with the managed care plans. We did hold a meet and greet with one managed care plan, which is Partnership Health, back in January for our child welfare directors. We're going to look at doing this also with Kaiser, Anthem, and HealthNet. And so they're all on board about coming together separately. We're going to hold these separately with each managed care plan and the counties. So we'll have more information about that probably mid to late June about when those meetings will take place and helping counties and managed care plans come together.
That's exciting. Anyone else want to share anything that on the CWS MOU or on the IHSS MOU as well? All right, so we're going to just reiterate some of our best practices for working with our managed care plan partners. Again, I think they're here to stay. I think it's worth investing in the relationships with them. I do think that there's a lot of benefits, not just with getting an MOU signed or whatever that looks like, but I think there's long-term benefits to these relationships. How do you bring them into the community? How do you help them make good investments? So when more funding opportunities arise, how do we advise them or bring them into the fold so they understand what the needs of our county happen to be? How do they have an impact on addressing those needs? So thinking about that. So I think the biggest thing is collaborate. However, whenever, wherever, invite them out for coffee, invest in those relationships, really try to get to know them. Again, they are working really hard as well. So giving them opportunities to learn some successes your department has had or your agency has had, some of the things you're working on. I think all of those things are good to share. They need to feel like they can have a positive impact, just like we all need to feel like we can have a positive impact on the problems we're addressing. Where can you align with the managed care plan? How do you work with them and be part of the decision-making process? So we know, again, there's new funding coming in. How do we engage with them so they can make informed decisions about where to put that new funding in your county? How do we work with them to create policies that really address the needs of your county? We do have some of these plans like partnership, like Kaiser, that are serving multiple counties across the state. How do we help them know what your county needs, how you may be different in the county next door? So working with them to really understand what your populations need. I think there's just more and more things we're going to start to see as more things get pushed out through managed care. Again, how do you engage with them? How do you be at the table when decisions are being made? How are you a trusted partner they can bounce ideas off of? Start to build that type of relationship as well. Michelle, I see you have your hand up again. Please jump in.
So one of the things that came up in our call on Monday was that it is partnership and they have 24 counties under them, and it sounded like she was a little on the, we can't make such specific agreements with every single county. We want to try to make them on a more broader scale. And, and I get that from their perspective. It's probably much more difficult to have something that's so specific to a county's needs. And I just tried to reiterate to her that we are in a resource desert and that we have our provider availability in this area is very, very scant. And so when we have children who need specialty services or even non-specialty services, dental care, it's just not available. And so we have to take a lot of this stuff outside the area. And what does that look like? And I understand that if they're covering counties that are nearby, which they are, they're covering a lot of northern counties, that it might be beneficial for some of us northern counties to get together and have a conversation about, we all have some of these same big problems with provider availability, and we negotiated this. Is that something that you thought of, or something like that? So there might be an opportunity for counties to work together as well when we are contracting with one managed care program.
Michelle, I love it. So I love two things here. I think it's great that you can see it from their perspective, because that will help you be a good negotiator with them on all of these issues. And I like that you're trying to find solutions that may address their needs as well as your own. So I think that is wonderful. And I encourage counties that may face similar issues to come together, because it makes it easier for the managed care plan to agree to things if it's going to, meet multiple counties' needs. So I love it. So yes, please keep sharing all of this, Michelle. It's great. Anyone else want to come off mute and share some of the things they've been doing or the conversations they've been having with their managed care plans? Marie, if you're still on from San Diego, do you mind sharing some of the work that you've been doing in San Diego to work with your multiple commercial plans?
Gretchen, if I knew the answer to some of that, I would tell you, but
okay. Well, I can't pick on you here.
Don't pick on me. I came to be trained about.
Okay.
Laura, who was with you still on the call, she made them.
Okay.
Hi. Yeah, so we meet with our managed care plans weekly. We've sort of taken a little bit of a hiatus the last couple of weeks, but it has been a weekly meeting. It's really just everything you've mentioned. They are having a really hard time understanding a lot of the work that we do in child welfare. And so it's just been a lot of educating them and a lot of back and forth. And what we've sort of come across is the folks from the managed care plans that are in these weekly meetings don't feel comfortable making decisions to move forward on anything on the MOU. So then they're taking it back. And so it's just sort of this back and forth of, well, I don't feel comfortable with this language, or I don't feel comfortable with this, so I need to go back. And so I don't know if anyone else has had that experience, but that's one thing that we've been finding a little bit of a challenge. We did have Alex Briscoe come to one of the meetings too, and sort of gave a discussion, and he went over his PowerPoint and met with us a couple of times with them. And so that helped a little bit also, but we're still kind of stuck in some areas.
I'm glad you raised that, Laura, because we've seen this across the board where the folks they send to these meetings aren't the decision makers. And so how do you start to get those folks in the room? And sometimes we see the local plans sending the right people more often than commercial plans, but not always. So I think that is unfortunately kind of the hamster wheel that we often run with some of these staff members. Anyone from Sacramento want to share what they've been doing? Maybe they dropped off. Okay, well, I'm going to keep us moving so we can look at just a quick review of the MOUs and just thinking again about what actions to take. I think a lot of you are already doing this, really engaging your managed care plan, starting the conversations. If you're still watching to see what's happening, I think calling up your neighbors and finding out how they're thinking about these MOUs is going to be important as well. So now we're going to jump into the behavioral health landscape. Again, this is another piece that state has rolled out that's not necessarily under the CalAIM umbrella, but still has lots of impact on the populations we work with. I know some of these programs were hit hard in the budget cuts or the May revised version that the governor put out last week. So I think things are changing, but I did just want to draw attention to some of the things that are happening under behavioral health. Outside of CalAIM. So we know that the state does want to have a lot of community-based providers be involved in treating our vulnerable population. So how do we start to build that continuum of care? How do we start to engage different types of providers, especially in the behavioral health ethos? So looking at doing that through a couple of different initiatives here. BH Connect is kind of one of them. We also have the Children and Youth Behavioral Health Initiative, all kinds of different pieces. And again, some of these got hit hard in the proposed budget. So we'll see what actually happens when they finalize the budget by the end of June. BH Connect, again, is really trying to build out those community-based services, really trying, again, you can think about all the reasons why this is happening. Similar to CalAIM, we want to really break down silos. We want to serve folks in the most appropriate level of care. We want to, save our budget. So looking at what are the ways we can serve people effectively at the lowest cost setting. So looking at doing that through the BH Connect. The Children and Youth Behavioral Health Initiative, again, same type of thing. How do we engage folks in the different ecosystems that they're involved in? How do we do a whole system approach? What's the no wrong door approach here? So really trying to address that. We'll see what happens with budgets going forward on this initiative. And then I think the final piece of our training here today is just trying to connect all the dots. We've done a lot of information dumping here on CalAIM and all the different pieces, and it's a lot to take in. And I'm sure for a lot of you who are here to learn, you're trying to figure out what is really relevant to the work that I'm doing, what is really relevant to my county. And so thinking through that is going to be important. And I think there are many different ways for counties to get involved and to stay involved in all of these different initiatives. I think there's a whole system of care approach that we'd like to take with our managed care plans. How do we start to include them in the system of care and the meetings and the work that we're doing? How do we address the challenges that bringing in the managed care plans to our meetings, to our work, to our partnerships? What does that look like? How do we address those challenges? How are we good partners to them? And how do we support them in being good partners to us? So I just encourage you all to think about that. Think about what the right role of the county is. I mean, obviously MOUs dictate a lot of that, but if you look at the CalAIM pieces, where does the county fit into that? Are you a support program? Are you a provider? Are you a referral partner? What is the county's role as these new Medi-Cal transformations get rolled out through managed care? A question that we got asked during the break, and I want to just put on the recording so everybody can hear, was really what are the county's role, especially if you look at CalAIM. Does CalAIM, let's just take enhanced care management and community supports, does the burden fall on the managed care plan to roll out these programs, or is the burden on the county to help roll out these programs. And so one of the things I think a lot about is that for most counties, the managed care plans have done a pretty good job in rolling out enhanced care management community supports. They have made applications available to providers who want to become a contracted provider. They have tons of training set up to try to help folks become successful providers, not just in doing the services, which most providers are very good at, but on the administrative side, the billing, the reporting, all of that good stuff. We are seeing some counties where a lot of local providers have not wanted to become a contracted provider. The administrative burden is difficult. Being a Medi-Cal provider is a little bit daunting. The rates aren't good enough, et cetera, et cetera. And so in those cases, we are seeing the managed care plans start to contract with out-of-county providers, which has benefits and drawbacks. And I think as we look at our county and who our providers are and what services we want to see in our county, I think there does become a role for the counties to step up and invite providers into the CalAIM space. It could be as a referral partner, making sure that all the folks that we are working with are being referred into the most appropriate programs, whether it's ECM, community supports, other initiatives. It could also be encouraging our local providers to become a contracted provider with the managed care plan, providing support, maybe even TA to those providers to be able to do this successfully. So I really encourage all of you to try to connect all the dots for all these different things being rolled out and think about what is the best role in your county for your county and the different components that we've talked about today. So as Andrea has mentioned in the chat, we do have some technical assistance times coming up. One of them is tomorrow morning. We also have one next week. So if you want to dig into these topics a bit more, you just have a few questions, you can come pop in for 5 minutes, ask your question, hop off, whatever works best for you, but we do encourage you all to come. We have had folks come that have not attended these trainings, and that's completely okay too. We're happy to walk through some things. We're happy to go to the slides and talk about it more slowly or tailored to your county. So join us, ask your questions, invite staff, and we couldn't attend. We look forward to talking with you all. And then again, we are starting a more tailored training next week to ECM and community support. So if you have an interest in those two programs, please join us. Andrea, did you want to say anything else before we wrap up?
You know, I do. I actually just looked up a quick poll. I want to gauge the folks here to see their interest in joining a 201 training and taking you up on your offer for office hours. So yeah, there's 2 questions in this poll. Are you planning on attending a 201 training? And the second question, are you planning on attending a drop-in office hour session? We just wanted to encourage, folks to take advantage, Gretchen, of your expertise and Baljeet's and the other partners that may be in and around this work, especially each other. What we found in the first couple of office hour sessions is that one county, when they drop in with their context and questions, as nuanced as it is, the other counties on the call get sort of inspired by that question and start thinking and then offer something else. So it ends up being a little bit of a peer sharing forum, which I think is what we all really enjoy. I think we have we've got some questions around adults services and to the extent that you see, Gretchen, managed care plans being involved in county MDTs. And if you see that would be growing and gathering traction. So I think we just have that question in chat, and I just wanted to kind of lift that up as I will end the poll and share the results. Can you speak to that while I end the poll?
Let me come off mute here. So yes, I will definitely do that. So the question, I'm just going to read it out loud for folks who get on the phones, is looking at the providers who are contracted for your county and not seeing the ones you expect to see on those lists. So as backdrop, the managed care plans are required to list all of their contracted providers on their websites. Now, that's not to say that what you see there is absolutely correct. And I will say Partnership and has had a challenging time as they've grown to keep up their list. But with that aside, I think it's really important to look at who's there. And if you see organizations that are missing that you think should be on those contracted lists, I think it's really important to start to think about how you can support your local providers to get involved so that you can have that continuity of care for the folks you're working with. So I really encourage folks to look at that. And then Shannon, I see you just put in, is it possible to get the MOU recording before we leave today in the chat, or will it be emailed? So I'll let Andrea answer that question.
Yeah, Shannon, were you at the MOU walkthrough? If you weren't, all the participants that were at the MOU walkthrough got the recording. And so if you need, can you just give me an email? So I have your email address and I can send that to you as well. And then the
Okay, thanks.
Yeah, sure, no problem. And the flyer for the TA office hours, I think I put it in chat a couple times. I'll download it again. My bandwidth is super slow today, but if you scroll back, it is in chat already. For those of you on that poll who said, yes, send me that flyer, just scroll back in chat. It is there. Thank you so much, Gretchen and Baljeet. Thank you. Thank you to all of you who lifted up questions and participated. I think it just gets richer the more people are sharing their stories and talking about the innovations. We at CFPIC are very interested in providing the right kind of support to counties as they think about what are the opportunities nested inside their county teams, whether they are the MDT on the adult side or the 2083 on the child and family serving side. The county teams that are together, to the extent that you all are beginning to partner with your managed care plans, we want to figure out how to provide the best TA to you all to figure out what are those mutual benefits. What are those positions that are perhaps we can contract for different positions. I heard in a direct chat of a community health worker is something that a county is looking at, and it's something that could be contracted and sort of shared between the managed care plan and the child welfare program. How innovative. So these ideas, the opportunities, the way that you all are thinking about leveraging your dollars and your partnerships makes sense to us. So I hope today was important. I hope it was valuable to you. Please come back to the 201 training or the office hours. We will continue to try to be an organization that provides information and sort of circulates strategies and lessons learned. We want to push that out and share that to all 58 counties. And Shannon, I noticed you're here with CDSS. Thank you for being here, because I know the System of Care branch at CDSS, you guys are just